My world shattered. How could this happen? He was healthy. Nothing else was different that day, except the flu shot. I was never given informed consent. I was never told about the lack of long-term safety studies. I was never told about the ingredients like polysorbate 80 or the fact that true placebos were never used in many vaccine trials. I was given a simple sheet saying to expect a fever and use Tylenol. I wish someone had warned me. I wish I had been told to research the vaccine inserts, to look deeper, to look at the history, the true history. I wish I had the chance to fight for his life in the hospital, or given any kind of chance. Parents deserve the truth. We deserve real informed consent, because no parent should have to live the nightmare I do. To all the parents listening, you can never unvaccinate, but you can wait. Wait until it's truly proven safe. One shot, one decision, one moment. That's all it takes to shatter a family forever.
Our final witness is Ms. Krystle Cordingley. Ms. Cordingley is a public scientist with over 20 years of experience in the medical field. She's here today to talk about her son, Corbyn. Ms. Cordingley.
Chairman Johnson, Ranking Member Blumenthal, and members of the subcommittee, thank you for the opportunity to share my story, the story of how our lives were shattered in an instant and the nightmare we now live every day. My name is Krystle Cordingley. I'm a mother of 5, and this is about my son, Corbyn D. Cordingley. He was born on September 2nd, 2012, healthy, vibrant, and perfect. He hit all of his milestones early and was a bright, loving, and busy little boy. Our life before his death was full of love, joy, and innocence. I am a scientist and fully believed in the safety and effectiveness of vaccines. I never questioned them. I thought I was protecting my children by following the CDC's vaccination schedule. Corbyn received all of his routine vaccines on time, including his 12-month shots 43 days prior to his death. On October 18th, 2013, I took him in for a combo flu shot that would be administered in 2 doses. He seemed fully recovered from a recent cold, and it was a normal day. I fed my kids lunch, prepped dinner, and left for an evening shift at the hospital. That afternoon was the last time I would see my baby alive. At 8:30 p.m., my husband gave the kids a bath and rocked Corbyn to sleep. He laid him in his crib, safe and sound. When I came home from work at 11:45 p.m., I went to nurse him. What I found haunts me to this day. My baby, face down. Fists clenched, arms stiff straight to his side, body stiff and unresponsive. I screamed for my husband to call 911 and immediately started CPR. When I opened his mouth, his tongue was stiff with rigor mortis and his lungs gurgled with broken down lung fluid as I tried to breathe life back into him. I knew. The paramedics arrived within minutes, but it was too late. At the hospital, after what felt like a lifetime of trying to revive him, the ER doctor called time of death. My world shattered. How could this happen? He was healthy. Nothing else was different that day, except the flu shot. I repeated it over and over to every medical professional. He got his flu shot this morning, but no one would ever consider it. I was brushed off, told it couldn't have been the vaccine. I was gaslit into believing some babies just die. But no, they don't. Not like this. I held my son's foot in the hospital until it went cold in my hand. Do you know what it's like to hold your lifeless child until their body goes cold? I prayed so hard he'd wake up that I became physically ill. His lung fluid soaked my jacket, and I've never been able to wash it. It's still in his laundry basket, along with all his other dirty clothes, untouched. Days later, I called to cancel his follow-up flu shot and told the pediatrician Corbyn had died. Her immediate response was, "I don't believe the shot had anything to do with it." The medical examiner said the same, even after I asked her to send out testing. A month later, she admitted she forgot. When she finally did send tests, none of them had anything to do with determining whether the flu shot played a role in his death. Still searching for answers, we did every genetic test available. Myself, my husband, and our daughter. All clear. 2 years later, I submitted Corbyn to a research study. They tested his brainstem and hippocampus. The lead researcher called me personally shocked. She said the damage and scarring she saw was typical in SIDS cases, but Corbyn wasn't an infant. He was 13 months old, and he was perfectly healthy. Damage, not defects, not abnormalities, damage to his brain. Despite the pediatrician denying the vaccine's role to my face, I found a note in Corbyn's records that she had filed a VAERS report just days after his death. She never told me. The report said, "The parents will not be contacted." She also suggested I continue vaccinating my other children and offered hospital observation after each dose. Why offer observation if vaccines are safe? I was never given informed consent. I was never told about the lack of long-term safety studies. I was never told about the ingredients like polysorbate 80 or the fact that true placebos were never used in many vaccine trials. I was given a simple sheet saying to expect a fever and use Tylenol. I wish someone had warned me. I wish I had been told to research the vaccine inserts, to look deeper, to look at the history, the true history. I wish I had the chance to fight for his life in the hospital, or given any kind of chance. I speak today not only to honor Corbyn's memory, but to urge you to ask the hard questions. Parents deserve the truth. We deserve real informed consent, because no parent should have to live the nightmare I do. To all the parents listening, you can never unvaccinate, but you can wait. Wait until it's truly proven safe. One shot, one decision, one moment. That's all it takes to shatter a family forever. Thank you.
Thank you, Ms. Cordingley. I want to thank all the witnesses. I know telling your stories is not easy. I think I speak for everybody in this room, committee members. Our sincere condolences for your losses, for the tragedies that have really impacted your life. The divide here is wide. I don't doubt any of these stories. I don't. Where are vaccines useful? Where have they prevented death and disease? My guess is they have. But I also know that vaccine injuries are real. As I said at the onset, and they've been ignored. From both sides, we've heard misinformation. I mean, it's a weaponized word. Dr. Hooker, you've probably done as much, if not more, research into this area as anybody. Can you just comment on anything you've heard? And again, I don't want to make this contentious. I mean, you've all suffered horrible loss and tragedy, but this is a discussion. This is a debate. These are truths we have to seek out. So, Dr. Hooker, can you just? I mean, I'm just going to let you comment on things that may have struck you that you want to comment on.
You know, we've heard over and over and over again industry canards and, you know, things that are cringeworthy to me as a parent and as a scientist. The preponderance of evidence around vaccines and autism basically in the United States consists of two studies that were done by a flawed and fraudulent CDC, one on thimerosal-containing vaccines and one on the MMR vaccine. Clearly, in the MMR study, when you look at the table, it shows a statistically significant effect of the MMR when given on time. 67% more boys getting the vaccine on time get autism diagnosis than those that merely wait until 3 years of age. Now, I had a whistleblower come forward to me to tell this information, Dr. William Thompson, in 2013 and 2014. We also know that the Verstraeten study in 2003 is also flawed, fraught with errors, and fraudulent, accusing them of directly cherry-picking information from the vaccine safety data link because of issues with clinics. Now, there is a hole in the science around vaccines and autism that you can drive a Mack truck through. You can't just look at one vaccine and one component and then wave your pixie dust and say they're safe. That is just not a fact, and that is just not how science works.
Dr. Hooker, you mentioned Bill Thompson, and he was featured in the first movie, Vaxxed. Can you tell the story about that particular MMR study that I think identified a link between autism and MMR in black young men, right?
That is correct.
Tell about the story about the CDC officials that gathered with their data, and was it a shredder? Tell about the story of them coming together and destroying their evidence, but Dr. Thompson did not do so.
Dr. Thompson did not do so.
Tell the story, though.
I will, yes. The CDC scientist who was the lead epidemiologist on this MMR study was Dr. William Thompson. He came forward to me in 2013 through a series of phone calls, and we were in close contact for 10 months. What happened was he found the African-American effect, that African-Americans were over 200% more likely, and African-American males over 300% more likely to get an autism diagnosis if they got the MMR vaccine on time versus if they were received the vaccine after 3 years of age. And when they got that evidence, when they got that information, they were told directly by the supervisors on the study, the same supervisors who were the co-authors of the Agent Orange.
Oh, wait, go ahead and name names.
Yes, Dr. Colleen Boyle and Dr. Frank DiStefano. They were ordered directly to destroy evidence and destroy federal records in violation of the Federal Records Act as amended in September of 2002. That information was destroyed. Dr. Thompson shared that information with me directly. I repeated the analysis, did the exact same analysis, and I got the exact same result. African-American males, when they get the MMR on time, are 3.5 times more likely to get an autism diagnosis than if you wait simply until after 3 years.
So that would show a link. And again, I think
that is correct.
The important part of this story is not only that, but the fact that you had federal health agency officials destroy evidence of that fact. They gathered everybody in office, right? And they literally all brought the evidence and they destroyed it together, except for Dr. Thompson. He kept the evidence, correct?
That is correct.